Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Eggshell calcification of the lymph node on the chest X-ray. So there are some findings such as silicosis. So in silicosis also we see the eggshell calcification on the X-ray. So silicosis, and the specialty of silicosis, it is the most common. And then there is also presence of the sarcoidosis. Sarcoidosis. Next, there is also the post-radiotherapy, post-RT, that is radiotherapy, and post-irradiation lymphoma. Post-irradiation lymphoma. Next is there is histoplasmosis. There's histoplasmosis as well as blastomycosis. There's presence of blastomycosis. Then comes amyloidosis, and the tuberculosis, TB, tuberculosis. To learn and grow daily like this, please do subscribe.